Childbirth can trigger postpartum psychiatric episodes even in women with no history of mental illness. A new study published by The Lancet reveals that 3 severe mental disorders commonly affect women shortly after giving birth: postpartum psychosis, bipolar disorder, and schizophrenia. Women who suffer from postpartum psychosis usually lose touch with reality. They often have hallucinations and delusions 1 to 3 months after giving birth. Bipolar disorder, also known as manic depressive disorder, causes mood swings ranging from bouts of severe depression to manic highs. Mothers with schizophrenia often experience disordered thinking and behavior, delusions, and hallucinations. Suicide is the leading cause of death in women with mental illness. In fact, deaths associated with psychiatric illnesses are continuously increasing, according to a research published by the Medical Journal of Australia. In the United Kingdom, suicide is now considered as one of the leading causes of maternal death. Severe mental disorder during pregnancy and after giving birth usually happens as a continuation of a chronic psychotic illness, an illness that affects not only the mother, but also her newborn baby, her family, and other people living around her. A U.S. epidemiological study published by Archives of General Psychiatry shows that 0.4% of pregnant women have psychosis, and another 2.8% suffer from bipolar disorder. Bipolar disorder has a high recurrence rate of up to 85% in women who discontinue taking their prophylactic medication, according to Dr. Vergara of the Department of Psychiatry and Psychology at the Cleveland Neurologic Institute. Most often, women who are on medication to control the episodes of their mental illness stop their treatment once they discover that they're pregnant, because of the fear of having a baby with congenital defects, leading to rebound psychosis. Psychosis that happens right after giving birth usually has a rapid onset. This may be in the form of severe psychotic depression, mania, or mixed episodes characterized by unexplained ecstatic episodes and low moods. The core features of psychosis, like hallucinations and delusions, are present, and these symptoms usually appear within 2 weeks after child delivery. Some women may show 50% of the symptoms within the first 3 days after giving birth, according to a study published in the British Journal of Obstetrics and Gynecology. Risk factors for the development of postpartum psychosis include a history of bipolar disorder and severe postpartum episodes in previous pregnancies. Other risk factors include pregnancy and delivery complications. Psychosocial factors, such as a stressful life event and lack of supportive partner, may also play a role. In some women, the loss of sleep can trigger the onset of mania. Genetic factors may also contribute to the development of psychosis. In fact, a study published by the American Journal of Psychiatry suggests that the problem may be in the chromosome 16 in susceptible individuals. Pre-pregnancy care is one of the cornerstones in the treatment of severe mental illnesses during pregnancy and postpartum. All women having a history of mental problems should receive advice from a qualified perinatal specialist about pregnancy and parenting and their possible effects on mental illness outcome. Mothers-to-be should learn the risks and benefits of treatment options and medications, and they need to be aware of the effects of stopping and restarting medications during and after pregnancy. The risks and benefits of taking medications during pregnancy should be discussed with a qualified specialist, because relapse of mental illness during pregnancy and postpartum period does happen. Postpartum psychosis is a psychiatric emergency. It can be severe and can vary in intensity from hour to hour. Sometimes being admitted to the hospital is necessary. Having a supportive family for patients with psychosis is important. Postpartum psychosis responds well to treatment. Only 26% of cases continue to have symptoms a year after giving birth. However, even after treatment, there is more than 50% chance of having psychosis again, even when they're no longer pregnant.